Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the country breaches the 70,000 mark, with the National Capital Region dominating the most number of cases daily. Should Metro Manila return to stricter quarantine status? And President Rodrigo Duterte urges local leaders to run after quarantine violators and warns that the police may arrest violators to teach them a lesson. Presidential spokesperson Roque joins us live. And online content creators and influencers join forces to help medical frontliners. Celebrity vlogger Erwan Husaf tells us more live. Another spike in COVID-19 cases in the country as the total count nears 71,000. Most of the new cases are from Metro Manila. A recent projection by researchers from the University of the Philippines and University of Santo Tomas shows the country's COVID-19 cases may surge to at least 85,000 by the end of the month, with 2,000 deaths. Let's go straight to the source of the story. We have Presidential Spokesperson Roque. Secretary Roque, good to have you again. Maraming salamat po sa oras.
Good morning, Pinky, and good morning, Philippines.
So 70,000, sir, 764, almost 2,000 new cases recorded yesterday. UP has predicted that this will reach by about 85,000 by the end of July 31, sir. Is this something that we should be alarmed about? Because if we continue this trend, sir, 1,500, 1,800, definitely po aabot tayo dito sa 85,000 by end of July.
Well, I wouldn't really say it's something alarming, but it should concern all of us. No? I had a discussion with the UP people behind the forecasts. And the first thing I asked them was, am I correct in exhorting people to take steps so that we will not realize your forecast? And he said, certainly, because not meeting the forecast means less people getting sick with COVID-19. So I can only exhort people, in fact, to take steps to minimize the spread of the disease. But on a macro level, we look at the death rates. It's still very low. Yesterday, if I'm not mistaken, it was under 5. We look at the positivity rate. It is still within the accepted standards imposed by the WHO. We have risen to 8, but the threshold is at 10. And the R0 is 1.2, 1.3, although the ideal should be at 1 so that we could limit really the spread of the disease. But I think the good news is yesterday in my press briefing, I noted that our critical care capacity is back again at 50% as of the latest data of the Department of Health. Which means that we are able to provide for critical care to those who will need it. Now, the numbers, I think, will continue to rise for as long as we don't have a vaccine and we don't have an antidote to it. I would like to see the numbers decrease, and I think it can be done, especially now with the DOH pronouncement that those who are asymptomatic and with mild cases should nonetheless proceed to isolation centers if they don't have separate bedrooms and separate bathrooms. I think that's one of the key things that we should be doing now, because in the past, we were told that if you're asymptomatic, you can stay at home without the qualification that you needed your own bathroom and your own bedroom. But now that that's clear, I think, and with the quality of isolation centers that we have, I think we can rein in the numbers further, or even if we have reached 70,000 already. Now, there's also a proposal now coming from various sectors, and I think it will be implemented. We are continuing with localized lockdowns, and we will accompany the localized lockdowns with massive, intense, targeted testing using both PCR, pool testing, and antibodies, because you can actually have a protocol combining all these. So we should have more intensified testing, although we have reached the 1 million level, and we're going on our 2nd million testing. If this is done, I think we can still rein in the
But
number, and this is the observation made by the WHO. No matter how dire, we could still rein it in.
I understand. We've talked this over and over again, Secretary Roque, about case doubling rate, mortality rate, and are not, sir. However, when you look at numbers such as 2,000, 1.8, or 1.5, averaging possibly in the past week or so, sir, it makes some people wonder if we're actually really, is the strategy really working? Because understandably, sir, there's more testing now. That's definitely what's been said by government. Mas marami na po talagang tinetest ngayon, pero yung numero po patuloy na tumataas.
Well, Pinky, as we improve our testing capacity, we are bound to get more numbers. And what's important really is that we are able to isolate and trace the people that they came in contact with to contain the spread of the contagion. No? So I think the numbers per se will increase with increased testing. That's a foregone conclusion. And that's why our positivity rate, which is the number of persons per 100 persons testing positive, have also risen because we have intensified now. Now we have 27,000 tests daily. Compare that with, a few hundreds in the beginning in January. And we're only talking really of about 4 to 5 months. So I think the situation is for the better now that we have more intense testing, and now that the president has also appointed and designated focal persons for the isolation, for the tracing, and the
The
treatment,
four czars.
I'm confident that we will prevail.
So you think the strategy is still working?
The strategy is working because people are still, an overwhelming number of people have been spared from the disease. I keep on reminding people that unless we actually took the steps that we did, we could have had up to 3.5 million cases already by now. And there's even a more dire prediction forecast made by the Philippine Center for Development Studies that it could have been as high as 20 million. So I'm actually asking people to compare the numbers now with the projected numbers if we did not take decisive steps that we did. Now, I know that there's some virtue in comparing our performance with other countries, but remember that each country is peculiar. No? Talagang marami talagang lugar sa Pilipinas na masisikip. Napakahirap talaga magkaroon ng isolation dyan kapag meron isang nagkasakit. Kaya nga, I think this Oplan Kalinga will be a game changer too, because now the symptomatic and the mild ones don't have to be spreaders. No? They can be isolated now.
Okay, so talking about that, Secretary, we have four czars. We have Oplan Kalinga. Secretary Galvez also wants 4 designated hospitals in NCR. I guess the question is, couldn't these strategy or these plans of government been done earlier on?
Well, as far as designating COVID hospitals are concerned, we have designated COVID hospitals. He just wants to expand them because our experience not long ago was that our critical care capacity reached dangerous levels. No? By having more COVID-dedicated hospitals, number one, we unburden regular hospitals of having to treat COVID patients so that they can concentrate on other cases that they have to attend to. No? But this has always been part of the strategy. PGH has been long designated as a COVID hospital together with NKTI, no? And now with Quirino Medical Center as well. No? So, but what he just wants is for more bed capacity for COVID because the private hospitals are particularly complaining that they can't allow more beds to COVID patients because of various reasons. No? So to fill the lacunae, the fact that private hospitals still are not able to allocate up to 30% of the bed capacity and have said that they will commit to allocate 20%, we need to have more COVID hospitals. Just to avoid the impression that we don't have enough hospital beds, when in fact we do.
Yeah, there are enough beds, sir. The problem with the hospitals, the PHAPI was saying that may kama, ang problema, walang sapat na health workers. That's the other part of the problem, sir.
Well, we have remedied that because the DOH is now hiring nurses even if they're going to work for private hospitals. No? We first did that in Cebu, and we're doing that as well in Metro Manila now. And the package that we're giving them is a package competitive with the public hospitals because after 3 rounds of salary standardization, the salaries now of public nurses no, tend to be at par or even more than private nurses. No? But the nurses that we're hiring now to work for private hospitals have the exact same compensation as the public nurses.
Senate Minority Leader Franklin Drilon, in a statement released yesterday or this morning, said, sir, that the Interagency Task Force has actually failed. He went on to say that what did Taiwan, Thailand, and Vietnam do that we failed to do?
I don't think we failed. For as long as we did not meet the 3.5 projection of UP, and UP has been very good at their forecast, no, I think we would have succeeded. We will always have different points of view, particularly because they're coming from the opposition, and I think they're resorting to politicking too early. The appeal of the president is to concentrate on the COVID-19, set aside politicking for the time being, which I think is a very wise policy.
Would you consider that politicking, sir, or just really his assessment of the situation as probably shared by other people as well, sir?
Well, again, no, I have to emphasize what could have been, and I have to emphasize the fact that mortality rate is low, critical care capacity is still good, and the fact that most of the cases are asymptomatic and mild. So when you say that we have failed, it's the fact that we have not reined it in and people are dying en masse. And I think right now, hospitals have gained competence in dealing with COVID patients. And this is the reason why we have minimized death rates. And for as long as we're minimizing death rates, I think we have succeeded. And there's no way I can change that position because one life lost now is too much, no? But when you consider that in the past few days, we've only had 2 to 3 people die, even if there are thousands of cases, I think that's still a success.
When do you think, Secretary Roque, when are you going to be comfortable? Kailan ho kaya tayo dadating dun sa punto na yun pong nakikita nating positive cases, we're going to start to see just a bend or a slowdown in the numbers, sir?
Well, I think it will come when we actually implement this more intense testing and isolation, no? And we will see it over a period of one month and not just 1 week. No? The proposal now, and I'm sure it will be acted upon, is to accompany, as I said, localized testing with intensified testing, no? Using not just ordinary PCR, but pooled testing. Because in pooled testing, you can get the swabs of about 10 people, put it in the reagent, and if they test positive, then to test individually each of the 10 persons, no, for PCR, subject them to PCR test. No? That way, you can multiply the available test kits that you have. No? Instead of testing just 10, you can test 100. No? And in this manner, we would get the positives, more positives, and isolate them and treat them. And meanwhile, contain the spread of the disease, as I said. No? And I think this will work. I'm confident it will work. But we just had to build the capacity of our testing centers first. Now that we have them, I think we can unleash the full capacity and concentrate on isolating the positives to contain the further spread of COVID-19.
All right. We'll be taking a very short break. We'll be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Presidential Spokesperson Harry Roque. Secretary, the last time we spoke, and the President kept us at our status here in NCR. We talked about the possible 2 weeks, the next 2 weeks until July 31, that it will somehow be a grace period to see where we're going. Do you think, sir, that kung umabot po tayo ng 85,000 by July 31, maghihigpit po ulit sa NCR?
That's a distinct possibility, although it's a possibility that I wish would not happen, because we all know that while we have to contain the disease, we also need to restart our livelihoods. No? We've come to a very crucial point where I think the economy can no longer afford to be shut down anew. But if we have to, and there's no alternative, we need to do it. But that's why I'm confident that the Filipinos actually will cooperate to even more greater degree than they have shown. Yesterday, I announced that we're second in the world as far as wearing of face mask is concerned. And this is according to the University of London. And that shows that the Filipinos will cooperate when they have to. And I think the message has been well received by the Filipinos that we need to really take care of our health so we can proceed and pursue a livelihood anew. No? So ang sinasabi nga natin, dapat ingatan ang ating mga ang ating mga katawan para tayo po ay magkaroon ng hanap buhay. No? So yes, a reversion to MCQ or a more stringent quarantine is possible. I hope it will not happen though.
Yeah, I was listening to your press conference yesterday, sir. Sabi nga 9 out of 10 Filipinos actually wear face masks. Ano po. Then that debunks this theory or ito pong belief na pasaway po ang mga Pilipino.
I inherently believe they're not pasaway. Kaya nga lang, yun nga, no, looking back, for instance, this Oplan Kalinga, this should really have been launched earlier, no? Because the former policy was asymptomatics and mild cases can stay home, probably because at the time we did not have enough isolation centers. No? I'm personally convinced that one of the things that will change the situation now is if the asymptomatics and the mild ones voluntarily isolate themselves in government facilities or in local government facilities. There are two types for the benefit of everyone. Yung HELOS 1 centers, which is national governments, and the centers maintained by the local government units, no? Which I think is more convenient because you are going to be quarantined in your own community. No? But this could be a game changer, and I encourage all those concerned to proceed to this to the nearest isolation centers. And I promise you, the facilities are like really staying in a hotel. It's like a 2-week paid vacation, no? Inclusive of 3 meals a day and Wi-Fi.
Yeah, you said that also yesterday. So, Senator Laila de Lima was, she gave a statement about Health Secretary Francisco Duque III. She says that the reason that he hasn't been fired is because the administration needs someone to keep as a scapegoat. And I quote, she says, "My guess is the president just needs a whipping boy for the tragedy that they themselves have brought to our nation." Just a reaction on that, sir, before I go to Sona.
I read the same papers and I watch the same news as Senator Laila de Lima. I can tell you the president has not been treating Secretary Duque as a whipping boy. The question I'm asked more often is why not? No? But it has never been the case that I think the president has ever used him as a whipping boy. He's always been supportive of Secretary Duque. He says mistakes have been made. For as long as these mistakes were done in good faith, then it's no reason for him to lose confidence. No? So let's leave it at that.
All right. Very briefly, yung pong SONA, this happens, of course, the 5th State of the Nation address on Monday, sir. What can we expect from the president's speech? Just an overview, sir.
Well, the president will personally appear before Congress, and I think you can imagine that the president will summarize the effects of the COVID pandemic, as well as the responses of government and the way forward, how the government will actually approach this problem. I think there's no other problem as big as COVID right now, and you can imagine that the upcoming State of the Nation address will discuss this pandemic in much detail. But I think the difference will be he will be presenting now a roadmap for recovery, which actually, if you've noticed, the economic team has not unveiled yet. And I think the reason is they want to unveil it in the SONA itself and in many forums after the SONA.
And we will watch out for that. Thank you to Presidential Spokesperson Harry Roque.
Thank you very much, Pinky. Always a pleasure. Good morning.
Thank you, sir. A group of creators and influencers are joining forces to raise funds for our medical frontliner celebrity vlogger. Erwan Husaf tells us more about hashtag Creators United PH after the break. Please stay tuned.